So, in that case, I am going to slide the table back and I'm going to be scoot forwards. Careful, son. Yes, yes. All right, go ahead and scoot forward, scoot forward. Careful coming towards you, careful coming towards you.
You want me to roll up more can
Yes, please, just so that they can see.
I think it will be easier if it was like this way, because you'll be able to bend your legs.
All right, so for this one, I'm actually going to be scoot back a little bit. We're going to do the inferiors. Good. So we're gonna do a unilateral one here first of all, okay? And we're going to be doing. Let's say we're going to do the left side here. So for the Settegast, okay, this is also known as like the sunrise. You're going to flex the leg about 90 degrees, right? And our goal is to get this patella by shooting up through it like this. Okay, so I'm gonna have patient shielded. This is when using the apron is a good idea because we're shooting up like this, right? The beam is gonna hit the cassette, it's gonna go through the cassette, and it's going to expose the patient when you're doing the sitting version of the Settegast. So if you have the full apron here to cover the patient, that is the best thing to do. Okay. Yeah, you're gonna be do the. We're gonna be doing. So you can do this a lot of different ways, right? It is a very flexible projection. So if you want to do it in the chair, you could. You would just need to be able to have more angle from the other direction. Right? It's very flexible like that, and it is up to you to detect how they want to do it. All right, let me just double check my angulation here. Okay. So the Settegast, the main thing here is going to be the angulation. Okay, so you have 90-degree flexion of this leg. You're going to be using this tibia, this lower leg, to determine how much you angle your tube. Right? So based off this line here, you want to be 15 to 20 degrees away from this line. Right? So if the leg is like this, 15 to 20 degrees is going to be something like this. Okay? And the whole point is 15 to 20 degrees will let you shoot through this patellofemoral joint space right here. Okay? So there is no set angulation on this tube. It is all going to come down to you eyeball this. So let's say, okay, I think that her leg is like this angle right here, right? About 45 degrees. So I am going to do, let's say 20 degrees, which will bring me down to right about here, right? So I'm now 20 degrees off her leg's angle. Okay, and now we're going to need to center. Where is my light? There it is. Oops, sorry, I'm not trying to blind you. So you'll notice, right, that I am right now under the table. My tube is lower than the table is. This is why we have the patient all the way here to the edge. Okay. We are going to try and enter right here at this patellofemoral joint again. Right there in the middle. Okay. We are going to try and get this as close to 40 as possible. I'm at 44 right now, so I can bring this a bit closer. Good. And then you can just rest the IR on the leg here. All right, good. So I'm at 40 as I go now. Just make sure that I am centered to the knee. Make sure I'm centered to the IR as well. Good, hold it still right there. Okay, so entering here at the patellofemoral joint, I'm going to collimate in. And then we are going to put our marker as well. Right, so we're getting this sunrise view. We see this patella, and then we see, right, so we have the patella up top, and then we have this dip in the femur down at the bottom, so we can see the patella rising over the femur. Once again, main thing here is the angle. It all depends on the angle of the patient's lower leg. Does this make sense? Okay, so this is your Settegast sitting method. Okay, so if the patient wants to sit down, you can do it just like this. All right, need you facing. All right, so this time, go ahead and lay down for now. You don't need to flip over yet.
Flip over.
Yes, flip over, because we do have the Settegast prone as well. Okay. For the prone, I am going to go ahead and put it back inside the bucky here. So when you asked if all knee projections are done in bucky, almost. But the Settegast will be outside the bucky. Let's see. Let's slide this down this way so that I can slide the table down as well. Come on.
Or not.
Doesn't want to work?
It will have an effect.
Stop working.
It doesn't want to slide. Here it goes. Careful, careful, careful. Okay, Casey, so this time I'm going to have you turn down onto your stomach.
This is why you should use me. I'm going to fall asleep.
That's okay. That's fine. I'm sure that you'll be able to stay awake long enough for this. All right, once again, we are in the bucky, so I am going to turn on my detent. I am going to try and lock my tube. Okay, so our goal in the Settegast prone is to get this leg and bend it 90 degrees again, right? We want to get this leg straight up and down. If we can get the leg straight up and down, we can angle the tube, once again, 15 to 20 degrees. All right, relax.
What if they can't hold that position?
Hmm?
What if the patient can't hold the position?
So if they can't do this,
Sitting?
then you do it sitting.
Yeah.
Exactly.
Sit in the chair.
Okay, that is why you do have multiple methods for this. I'm just going to get this as close as possible before we actually start reading the patient. Patient comfort.
And ventilation for this is 15 to 20.
15 to 20 for the tube ventilation. All right, so I think I'm pretty close here. Okay, so 20 degrees angulation. I'm going to take this leg, bend it up. Good. Nice and upright, nice and vertical. I'm going to center it right here to that patellofemoral joint again.
The sitting one seems easier.
Right there.
Yeah.
So the sitting one does seem easier, but this one is a lot easier to get your angulation on, right? Because you are guaranteed your 90 degrees, so you know you can just set this to 15 to 20. Right, and then wherever my marker went. Thank you. Okay. So in this case, it is going to be right, left side here.
The L don't go up.
So the way that we hang this is that the patella is going to be showing upwards. Alright. Now, do be careful with this projection, right? You'll notice that the leg is wobbly. A lot of times, techs will try and solve that wobble by doing this. Don't do this.
Will that mess up the image?
It won't mess up the image, but this is not safe for the patient. This is not safe for the patient or the machine.
Is
So
that why
don't
you
do that.
do not
Relax.
rest it on collimator?
Yes, that is why I put that in bold or in caps or.
Now I know.
No, okay. I should fix that. I should definitely put that.
Yeah, that's, I was
At least
reading it and I was
Every
like,
job is in place.
Have you seen somebody do that before?
I'm with you.
yeah.
So now you know why people might potentially try and do that. Don't do that.
Have you seen that before?
I have, yes.
Yeah.
Wow.
Wow.
Mr.
Thank you,
Fountain.
relax, Tracy. Thank you.